Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. And today joining us will be Dr. Erica Brendenstein from Reid OBGYN and Shannon Fanning from Reid Health's Continuum of Care. Welcome, ladies.
Great, I'm so glad to be here.
We're going to talk a lot about tobacco and nicotine use in pregnancy. And also then we'll also include marijuana use in pregnancy. So as we start out, before we get started, tell us how you both came to Reid Health. We're going to start with you, Dr. Brendenstein.
Well, I've been at Reid Health for almost 10 years now. I'm born and raised in Indiana, and so I'm a Hoosier girl, and I went to the University of Notre Dame and always wanted to come back and practice in Indiana, and so Reid has been my home ever since I got out of training, and I love it here.
Great. And you, Shannon?
So I've been with Reid a little over 17 years. I started in healthcare right in high school, went through a CNA course, and then always wanted to come work for Reid. I've been in Indiana my whole life as well, and saw this as a great opportunity to be a part of something big, and found that Reid was the best choice for me.
And just so that our audience knows, what's Continuum of Care?
So we are an outpatient care management group. So we have a lot of programs that are focused on the outpatient side to help patients help navigate through the healthcare system.
Okay, and I'll ask you some more questions later. One of the first things I wanted to discuss was with pregnancy risk and with smoking in pregnancy. What's some of the risks that are involved?
Well, I just want to thank you for having me on here to talk about this, because in particular, Wayne County has one of the highest concentrations of smokers in the entire state of Indiana. And so that carries on over to pregnancy. And a lot of women just don't know that smoking could potentially harm their babies. Some of the things that can happen include poor growth. So these babies can have growth issues in the womb. They're at higher risk of being born prematurely or early. There's also a higher risk of abnormalities of the placenta, which supports the baby and gives the baby nutrition during pregnancy.
Mm-hmm.
There's even a higher risk of stillborns with smoking in pregnancy.
And then also, it can affect their, like, the low birth rate?
Yes, absolutely. Mm-hmm.
And so what's some of the complications after birth in women that who smoke during pregnancy?
So, of course, we talked about the risk of the babies being born small, but what people don't know is babies can actually withdraw from nicotine. So babies can be more irritable, they cry more difficult to soothe, they can have feeding issues. Going forward, these babies are at higher risk for sudden infant death syndrome, which is considered to be just unexplained death of an infant. But we do know that in women who smoke during pregnancy or have smokers in the home, that there is a higher risk of this. These babies are at higher risk for having childhood obesity. They're at higher risk for having fractures and asthma. And they're also at higher risk of having more upper respiratory infections.
And when you were saying about the withdrawal, as people realize it's hard enough as an adult that with people who have tried to quit smoking. So imagine what happens within a baby who didn't even have a choice.
Mm-hmm.
So that's kind of scary.
Yeah.
So if you find someone that is smoking, what's the best benefit? How can they quit to protect the fetus?
Well, usually with all of our pregnant patients, when they come in for their initial appointments, we will get a good history to find out their health history, which will include any smoking, alcohol, drug use, so that includes smoking. And so once we've identified these patients, I think it's really important to spend time educating mothers on that this is something that could potentially cause harm to your baby. Also understanding that it is hard to quit smoking, and that a lot of these people have been smoking for many years before pregnancy, and so it may not be realistic to tell them to just stop smoking during pregnancy. Now, of course, it is best to stop smoking before you become pregnant. So if you are thinking about getting pregnant, you want to have a baby, you should really put some great effort into meeting with your doctor and quitting smoking before pregnancy. But if you do find that you are smoking during pregnancy, the thing that I most commonly will use with my patients is what I call the gradual cutback. So with nicotine, there's the habit of smoking, and then there's the dependence on nicotine, the physical dependence on nicotine. And so I've had good success with having my patients deliberately cut back. So if I have a patient that smokes half a pack a day, which would be 10 cigarettes. I'll say, okay, this week you're going to smoke 10 cigarettes, you know. Next week you're going to smoke 9 cigarettes, you know. And if they had a really bad week and that's hard, you know, maybe they'll do it for 2 weeks. But just allowing them to gradually cut back and gradually reduce the habit and also the dependency on nicotine has worked really well. There are other things that you could potentially use in pregnancy, like nicotine patches and nicotine gums. They're not as well studied in pregnancy. There are a couple studies of using that in pregnancy. I think it would be possible to use those things if you had a really highly motivated patient that had like set a quit date and was determined to stop smoking. But like I said before, a lot of people have been smoking for many years before pregnancy, and to have them just one day quit is not realistic for them. So there are medications that can be used to quit smoking when you're not pregnant that aren't well studied in pregnancy. So what I've had the most success with has been the gradual cutback.
Yeah, a lot of coaching. That's what it sounds like.
Absolutely, yes.
And the different types of nicotine. So as we see just with cigarettes, that's what people just assume. But what are some of the other kinds of nicotine?
So more recently, we've had more patients that have been smoking what's called e-cigarettes and then also doing vaping. And so I've had patients say, oh, well, I quit smoking, but I vape. So what they should understand is that that's still smoking, you know, that is still harmful. You're still taking nicotine into your body, which is crossing the placenta and going to your baby. So all of those risk factors that are associated with causing harm in pregnancy associated with smoking also carry on to the use of e-cigarettes and vaping as well. There are also potentially harmful compounds and chemicals that could potentially harm the baby too that we don't even really know a lot about. So it's not safe to move from smoking to vaping. It's not better to switch to an e-cigarette. It's not better for your pregnancy at all.
Yes, more and more as we start to see the research, because from my understanding there wasn't a lot of research done with vaping. So more and more we are seeing the results of
yes,
the harmfulness of the e-cigarettes and vaping. You were also saying about alternative methods that still result in nicotine with the crossing the placenta.
Yes. Yep. All the e-cigarettes, smoking cigarettes, it all results in nicotine crossing the placenta and potentially doing damage to the fetus.
And once again, that the infant can experience nicotine withdrawal.
Absolutely.
And what about the risk of lung disease?
There is a risk of, so nicotine has actually been proven to go to fetal lung tissue. So like I said before, babies born to mothers who have been smoking are at higher risk for lung disease, for asthma, and then also more likely to have upper respiratory infections. And then, of course, there's risks that go to the mother, to any smoker, you know, so that's risk to the mother of developing COPD, which is a chronic lung disease, and then, of course, risk of cancer, lung cancer as well. And so, you know, when women are smoking and sitting, because a lot of young women don't even go to the doctor unless they're pregnant. So it's a good opportunity to sit down with a patient and just talk about, okay, you know, you're smoking and this could potentially be harmful for your baby, but it could also be harmful for your long-term health. And then that journey to quitting that starts during pregnancy can continue and potentially make their whole lives healthier.
So can you give me some examples of an intervention?
Absolutely. So like I said, a lot of times I'll encourage patients to do the gradual cutback, and then at every visit we'll kind of keep track of how much they're smoking, how they're doing. There is one resource available through Indiana called 1-800-QUIT-NOW, and it also has a website. that you can go to. And if you go to indiana.gov, there's a link to 1-800-QUIT-NOW there, and they provide a lot of smoking support. They provide coaching, they provide accountability through the internet, and also through the personal coaching. They can help get you in touch with resources such as patches, gums, things to help reduce your gradually reduce your dependence on nicotine as well, are available through that program. And so that's one thing that that people can do in addition just to working with their individual doctors. And like I said before, in women who aren't smoking, there are other medications that you could potentially use to help quit smoking. So I really encourage people, if you are smoking, to talk with your doctor about quitting, because there are a lot of resources available.
And I'm sure, I know some people, especially some younger women, they think that it's a weight control by smoking. So I'm sure it's a double-edged sword when they are smoking as well as their body's changing, being pregnant. So that's another part that I'm sure you have to counsel on.
Absolutely.
But there's a wealth of programs within the community that people in pregnancy can look and view. So can you tell me about Healthy Start?
Well, that program they're currently on hold, but I spoke with them just the other day, and they're looking at restarting that program in the near future. But it is a great program, as it is an incentivized program for women. So as they're doing the counseling with the tobacco cessation, they then can receive gift cards to utilize for baby, buying diapers and wipes. So it is a really good program. We're excited for them to be able to restart that here in the near future, so that
And that's through Centerstone?
Yes. Yep.
Okay. And that's for pregnant moms and women with children?
Up to the age of 18, yep.
18, okay.
Yep.
And then in that program, they utilize, a community health worker, and then just the regular smoking cessation?
Yep.
So that's another thing that we would like the community to be aware of. Another thing we had spoke about is the 800-QUIT-NOW. And I've seen several people who have utilized that program and been very successful. This is really interesting to me. I just learned about the Resources, Education, and Support Program.
Yes.
So we're going to focus on Shannon now. And so can you share about that program?
Yeah, so we started the program, it was probably a year ago in 2021. We were working with the state of Indiana on the OB program that they wanted to start in all of the counties in Indiana. And so we have our perinatal navigation program, but we were not offering any home visits to moms. And this program is to help focus on the reduction of infant mortality.
And just so that the audience is aware, Indiana also has one of the highest rates of infant mortality deaths. So
yes. So we wanted to also implement where we could be supportive to moms and the babies within that first year of birth. So like Dr. Brandenstein said, every time you come in and you're pregnant, they do a new OB appointment. And so they will actually meet with my staff during that appointment as well. And we do a risk screening assessment. It has about 30-some questions on there, and we're really asking, what is their financial status? Have they had depression in the past? Do they smoke? And really get a kind of a clear picture of what that home situation is and what their life is. And so that allows us to then see if they could potentially be at risk for infant mortality. We then approach the moms and offer our program. It's 100% free for them, and it's an incentive program as well. So we have some really cool incentives for them for allowing us to come into their home. We like to do a visit prior to baby coming, so we usually try to come out around 34 to 36 weeks and kind of just see what that home setting is. Make sure that they have either a pack and play or a crib. They're aware of safe sleep practices. see what kind of resources they need. Maybe they don't have the funds to get a pack and play. We have some programs that we're able to get free pack and plays, car seats, and so we really just do a full assessment to see what kind of resources they need. And then at that first visit, we give a gift for allowing them to have us come. And then when baby comes, we visit again at 1 month, 3 month, 6 month, 9 month, and then when the baby turns a year old. And our big gift is that they could be eligible for a convertible toddler car seat at that 1 year visit. So we just had a couple of patients complete their 1 year visit, so we're really excited for that. And we just feel like it's a really great program. Just to be that extra support. Sometimes women and even new fathers or whoever may be in the home, they need that extra support, and we feel like maybe we could potentially be that little bit of support that they may need during that first year.
So you also counsel the fathers as well when you're on those home visits?
Yeah, whoever is living in the home, or if they're just visiting, if they identify any needs within the home or for the patients, then we address that at that time. We also can talk to them about child milestones, and then if they feel like they're not right where they need to be with those milestones, we can refer them out to some community services where they could come in and do an assessment and see if they could qualify for some like in-home therapy programs and things like that for the infant.
So overall, this program allows, one, it's a way to see how the patient is doing and in the actual setting that they actually live in.
Yes.
To see how they're working. So it sounds great.
Yes.
Another area. So if they're challenged with smoking, often they are smoking something else, and with that being with marijuana use in pregnancy. So, can you share with me what are some of the statistics?
Yeah, I'd love to share that with you. So anywhere between 3 and 28% of women actually smoke marijuana during pregnancy. And we do see it commonly even in the state of Indiana where it is illegal. Up to 60% of women who do smoke marijuana prior to pregnancy continue use during pregnancy. And so there's definitely a misconception out in the community as far as, will marijuana really affect my pregnancy? And I think most women feel that it will not, but there are in fact some harmful effects of marijuana on the unborn child. Mm-hmm.
And so what happens if it's in an area where people say, well, this is fine? Mm-hmm. So does that require some more counseling, or?
Well, a lot of times I'll have patients say, like, I'm smoking marijuana because it helps with my nausea. I'm nauseated, and so it helps with my nausea and appetite. But what they should understand is it's actually been researched and disproven that marijuana helps with nausea, vomiting, and pregnancy. And the other thing to consider is that there are plenty of safe medications that are not harmful to the fetus that we can use to treat nausea and vomiting in pregnancy. So there should never be a situation where you feel like you have to resort to smoking marijuana during pregnancy, whether it's medical marijuana or whether it's marijuana obtained illegally.
Do you ever have cases where people haven't told the truth, but then you discover that they are using?
Yeah, you'd be surprised, like who ends up having, you find out who's smoking marijuana. Like, it's extremely common. Like I said, up to 60% of people who smoke marijuana before pregnancy will actually continue throughout the pregnancy.
Wow. Mm-hmm. And what are some of the effects in pregnancy?
So marijuana does cross the placenta and go to the baby. So babies born to mothers who have been smoking marijuana will be born with evidence of marijuana in their system. And I think what's really sad about that is that it's been proven to actually affect babies developmentally. So if you smoke marijuana during pregnancy, your child might have behavioral issues that they wouldn't have otherwise had if you hadn't done that. They can sometimes have motor function delays. They can have learning issues as well. So it can actually affect neurologic development in the baby. And I mean, women, we do all these things when we're pregnant. We eat healthier, we take prenatal vitamins, we go to our doctor's appointments. We do all these things because we want our children to be healthy, because we care about them, you know. And so if you are smoking marijuana during pregnancy, it's important to know that stopping smoking marijuana could actually improve your baby's life outcome, you know. And so that is, if you're really wanting what's best for your baby, then definitely stopping smoking marijuana should be on that list.
And I was looking at some of the things that decreases their attention span, or the impaired visual motor coordination.
Yeah.
That people haven't thought. I don't think people even think about that. So.
Yeah.
And then the health effects on their mother.
Yeah, so marijuana, so first of all, it is illegal in the state of Indiana. So technically, if you are smoking marijuana, you are breaking the law, which is obviously not good. But it can cause impairment, you know, it causes impairment to the mother as well, you know, and it could potentially impair the mother's safety. People who smoke marijuana can sometimes, what I've seen actually a lot in my practice is women having other drugs in their system because they were smoking marijuana, and they didn't realize that it was laced with other things like heroin and cocaine. And that's not actually something or methamphetamines even, that I haven't seen uncommonly. But what the dealers will do in order to get their patients hooked is they'll add these other things into the marijuana, and the patients don't even know that they're getting that, which I think is sad. So definitely these patients who are smoking marijuana during pregnancy, like I said, because you feel like it's helping with nausea, or you think that you've always smoked marijuana and that's just something that you're going to continue to do, or you smoked with all of your other pregnancies. A lot of that's the case. You don't even know really what you're getting anymore when you're getting marijuana off the streets.
And how does that affect on lactation?
Marijuana on lactation. So marijuana actually does cross into the breast milk, and so it's greatly discouraged that women who smoke marijuana breastfeed. So, and we want all women to breastfeed because there are so many great benefits for breastfeeding. And, you know, there are very few circumstances in which we would encourage a woman to not breastfeed. What I would say is, if you're smoking marijuana, don't not breastfeed, just stop smoking marijuana. Yeah.
And medical marijuana.
Yes. So yeah, there are situations in which patients have been prescribed medical marijuana, but it doesn't make a difference. It's still not considered safe use in pregnancy. It's not approved for use in pregnancy. So even if you've had marijuana prescribed to you, it's still one of those things, just like there are some medications that we don't approve for use in pregnancy. It's still one of those things that's considered not safe in pregnancy.
Okay. Are there some community resources if someone happened to have a substance misuse in their system and they were pregnant?
Yeah, so, well, anyone struggling with any substance abuse in pregnancy, like Shannon and I have talked about, there are initial screening process that you go through when we find out that you're pregnant. And if you have a positive tox screen or you admit to substance abuse in pregnancy, we have great resources for any woman struggling with that. One is our maternal treatment program, which is up and running, very well established here in Richmond, where we treat women dealing with different types of addictions. And so that is a great resource for any woman struggling with addiction at all. So.
And how do they get in touch with and learn about that program?
So we have, if you're going like through our office, we have navigators that'll put you in direct in touch with either me, I'm the medical director, or with our staff who can get you an appointment usually within a week. So. Wow.
Did you want to reiterate that, a week? So in so many situations, when people are dealing with substance misuse, it takes months to get an appointment. So a week, that's awesome.
Yes, and the maternal treatment program is great because it offers prenatal care, it offers treatment to help with addiction, it offers social services, counseling, group therapy, everything all in one location to help women to be successful. And we take care of pregnant women, and we continue that care of women after they have their babies.
And this is all local?
Yes,
correct?
It's all local.
A quick thing on the navigators, that you have the patient navigators. So they work with you and from your department?
Yes, they do, and they're an excellent resource. They have a phone line that oftentimes our patients will have direct access to. So if they are struggling at any point on any day, you know, they have someone that they can call and get a hold of, and we can get them in and get them seen. And we have, I mean, it's wonderful. We have longer appointment times for our patients there. It's a family-like atmosphere where patients can actually bring their children with them to appointments, and so it's a great resource that we're really excited about.
That is great. And well, we'd like to thank both of you for joining us today on Reid Beside You. And make sure that our audience sees all these great resources and checks into that information. So we'd like to once again thank Shannon Fanning and Dr. Erica Brendenstein for joining us today on Reid Beside You.